Hi guys, do you know what is pulmonary inhalation is? Pulmonary inhalation is a preparation referred to a dosage form that are specifically designed to deliver drug directly into the lung via inhalation. They are used for purposes such as treating asthma, managing chronic obstructive pulmonary disease, relieving acute bronchoconstriction, and preventing respiratory exacerbation. There are several types of pulmonary inhalation dosage form. First, we have dry powder inhaler, or we call it as DPI. For example, budesonide plus formoterol. Second, we have metered dose inhaler, or MDI. For example, salbutamol. Third, we have soft mist inhaler, or SMI. For example, Respima. Fourth, we have nebulizer solution. For example, salbutamol nebulizer solution. And lastly, we have nebulizer suspension. For example, budesonide nebulizer suspension.
This slide shows the classification of pulmonary inhalation preparation, which are dosage form designed to deliver medication directly into the lung for the treatment of respiratory disease such as asthma and COPD. First, metered dose inhaler MDI. Metered dose inhaler are precious aerosol that deliver a fixed amount of medication per actuation. Example include salbutamol MDI and beclomethasone MDI. They are portable, convenient, and provide rapid onset of action. However, they require good hand-breath coordination. 2. Dry powder inhaler DPI. Dry powder inhaler contain medication in powder form without propellant, such as tubular, discus, and handihaler. They do not require hand-breath coordination, but they are not suitable for patients with weak inspiratory flow, including children, the elderly, and patients with severe asthma. Third, nebulizer. Nebulizer convert liquid medication into a fine aerosol mist. They are suitable for infants and elderly patients because minimal coordination is required. However, the equipment is bulky and the administration time is longer. Fourth, soft mist inhaler SMI. Soft mist inhalers such as Respima produce a fine, slow-moving mist that improve lung deposition. Their main limitation is the limited availability of medication. Next, important consideration for pulmonary inhalation preparation. Several important factors should be considered when using pulmonary inhalation preparation. First, patient factor. Patient age. Inspiratory flow ability to coordinate inhalation and treatment compliance can significantly affect the effectiveness of therapy. 2. Device selection. The choice between MDI, DPI, nebulizer, or SMI depends on ease of use, portability, cost, cleaning requirement, and the availability of spacer for MDI. 3. Safety and side effect. Local side effects include throat irritation, cough, and oral thrush, while systemic effects such as tremor and palpitation may occur, especially with beta-2 agonists. 4. Administration technique. Correct inhalation technique is critical for therapeutic efficacy. The use of spacer and proper patient education and demonstration can improve lung deposition. 5. Dosing consideration. Dose frequency, combination therapy, and dose titration are important to achieve optimal therapeutic effect while minimizing side effect.
Okay, for this slide, problem statement. Although inhaler drugs are the mainstay of treatment for asthma and chronic obstructive pulmonary disease, which is COPD, optimal disease control is not consistently achieved in many patients. Then, common challenges include incorrect inhaler technique, poor medication adherence, and variability in drug delivery to the lungs. This factor can lead to inadequate symptom control, frequent exacerbation, and increase healthcare utilization. In addition, some existing inhaler formulation may cause local adverse effect, which further reduce patient compliance. Lastly, the complexity of inhaler device also present difficulties for elderly and pediatric patients. Therefore, this is a continued need for improved inhaler drug and delivery system that enhance lung deposition, simplify device use, and ultimately improve clinical outcome and patient quality in life.
Active and inactive ingredient. Pulmonary inhalation preparation contain an active ingredient, drug for therapeutic effect, and inactive ingredient, excipient that aid delivery, stability, and aerosolization. Example for active ingredient, albuterol, budesonide. For inactive ingredient, lactose carrier. Manufacturing. Manufacture inhalation product are made on a large industrial scale with strict quality assurance standard and standardized formulation. They are available in various highly engineered delivery system. Example, albuterol, a bronchodilator used to treat asthma and COPD. Commonly available as an MDI or in a solution for nebulization. Extemporaneous inhalation preparation are individually prepared by pharmacists on a small scale when no suitable commercial product is available. Use is limited due to complexity and safety risks. Example, compounded ipratorium bromide nebulizer solution during shortage.
Product available in the market. In Malaysia, pulmonary inhalation preparation includes various inhaler, MDI, DPI with corticosteroid budesonide. Beclomethasone and bronchodilator often combined plus nebulized solution for nebulization like combivent salbutamol along with essential spacer, aero chamber and nebulizer machine. Way to use. Metered dose inhaler, MDI. This contains a pressurized canister that spray a set amount of medication. Preparation. Take off the cap, shake the inhaler well and prime it if necessary. Technique. Sit or stand up straight and breathe out completely to empty the lungs. Inhalation. Place the mouthpiece in the mouth, seal lips around it and begin breathing in slowly. Press down on canister to release one puff while continuing to breathing in deeply for 3 to 5 seconds. Post inhalation. Hold breath for 10 seconds to allow the medication to settle in the lung. Wait time. Wait at least 1 minute between puff in more than one is prescribed. Maintenance. Rinse mouth with water and spit out if using a corticosteroid to prevent infection. Number 2. Dry powder inhaler, DPI. These are breath activate, meaning they acquire a deep, fast breath to load the medication. Preparation. Lock a ducts. Example, twist the discus, click the flexhaler. Technique. Do not shake the device. Breathe out fully away from the device. Inhalation. Seal lip tightly around the mouthpiece and breathe in quickly and deeply. Post inhalation. Remove the inhaler. Hold breath for 10 seconds and breathe out slowly. Cleaning. Never breathe into the device or moisture can cause powder to clump. Number 3. Soft mist inhaler. Preparation. Remove the cap, set the inhaler well and prime it if required according to the manufacturer instruction. Technique. Sit or stand upright and breathe out fully to empty the lung. Inhalation. Place the mouthpiece in the mouth and seal lips around it. Begin to inhale slowly and deeply through the mouth while pressing down on the canister to release one puff. Continue inhaler for about 3 to 5 seconds. Post-inhalation, remove the inhaler from the mouth and hold the breath for about 10 seconds to allow the medication to deposit in the lung. Wait time. Wait at least 1 minute before taking the next puff if more than one dose is prescribed. Maintenance, rinse the mouth with water and spit out after use if the inhaler contains a corticosteroid to reduce the risk of oral infection. And the last one, nebulizer. This machine turns liquid medication into a fine mist for inhalation. Often used for children or those unable to use other device. Setup: pour the medication into the nebulizer cup and connect the mask or mouthpiece. Usage: turn on the machine and breathe in the mist through the mouth. The treatment lasts around 8 to 10 minutes. Cleaning the chamber and mask regularly to prevent infection.
New drug discovery. Okay, what is new drug discovery? New inhaler drug may play an important role in management of asthma and chronic obstructive pulmonary disease, which is COPD. This drug delivery medication directly to the lung, allowing rapid action and reducing systemic side effect. Then, for the advanced inhaler formulation and device design have improved drug deposition in the airway and enhanced patient adherence. To that, new inhaler therapies also support personalized treatment approach based on disease severity. Lastly, proper patient education on inhaler technique is essential to achieve optimal clinical outcome.
Okay, for the conclusions, pulmonary inhalation preparation are essential in the treatment of respiratory disease as they deliver medication directly to the lung, providing rapid action, improved therapeutic effect, and fewer systemic side effects. Their effectiveness depend on proper device selection, correct inhaler technique, and patient adherence. Future improvements should focus on developing user-friendly and environmental sustainable inhaler device, strengthening patient education by healthcare professionals, and advancing formulation technologies such as smart inhaler to enhance dose accuracy and treatment outcome.